Hello, and welcome to HealthyHorizone, your trusted space for practical health tips and age-wise wellness advice. If you're over 60 or care about someone who is, this video could change your life. Because today, we're talking about one forgotten vitamin your legs might be begging for. And even many doctors don't talk about it enough. Stick around till the end. It could be the solution to your leg pain, fatigue, and even that strange tingling sensation. Are your legs feeling heavy, tired, or weak lately? Do you experience numbness, cramps, or a pins and needles feeling in your legs and feet? Have you noticed difficulty walking, standing for long periods, or maintaining your balance? If you answered yes to any of these, your body might be screaming for vitamin B12. That's right. Vitamin B12 isn't just another supplement. For people over 60, it could be the difference between mobility and misery. Part 1. Why legs suffer after 60. As we age, our bodies naturally slow down. Muscles shrink, nerves weaken, and blood circulation becomes less efficient. But what many people don't know is that a hidden B12 deficiency can be a major contributor to these issues. Vitamin B12 is crucial for nerve health, red blood cell production, and energy metabolism. Without enough B12, your nerve signals misfire, your legs start to weaken, and your muscles don't respond properly. In fact, many seniors are misdiagnosed with conditions like arthritis or neuropathy, when the real culprit is just low B12 levels. Part 2. What vitamin B12 actually does. Let's break it down simply. Vitamin B12 helps maintain healthy nerve function, support red blood cell production, improve balance and coordination, prevent fatigue and weakness, boost mental clarity and mood. Without it, you might experience numbness or tingling in legs and feet, burning or crawling sensations, poor balance and frequent falls, muscle cramps or twitching, mental fog or memory loss. The scariest part? You can be deficient in B12 even if you eat a healthy diet, especially as your body's ability to absorb it declines with age. Part 3. Why B12 deficiency is so common. After 60, here's why seniors are more likely to be deficient. 1. Low stomach acid. As we age, our stomach produces less acid, making it harder to absorb B12 from food. 2. Medications. Drugs like antacids, metformin, and blood pressure meds interfere with B12 absorption. 3. Digestive issues. Conditions like gastritis, IBS, or even past surgeries can reduce absorption. 4. Vegetarian or low-meat diet. B12 is found mainly in animal products, so plant-based eaters are at higher risk. That means even if you're eating well, your body might not be using the B12 properly. Part 4. Symptoms of B12 deficiency you should never ignore. Here are some early warning signs your legs and body give you when B12 is low. Tingling or numbness in feet. Burning sensation or electric shocks in legs. Difficulty walking or climbing stairs. Loss of balance. Leg cramps at night. Extreme fatigue, even after rest. Pale or yellow skin. Mood changes like depression or irritability. If these sound familiar, don't ignore them. They could be signs of nerve damage beginning due to prolonged B12 deficiency. Part 5. How to fix it. Best sources of B12. Good news. It's easy to treat with the right approach. Here's how to increase your B12 levels. Foods rich in B12. Eggs, dairy products like milk, cheese, yogurt. Fish, especially salmon, tuna, sardines. Chicken and red meat. Fortified cereals. Supplements. B12 tablets. Cyanocobalamin or methylcobalamin. Sublingual drops or sprays. In some cases, B12 injections. Many older adults benefit from daily B12 supplements because absorption from food becomes difficult with age. Always consult your healthcare provider before starting supplements, but don't wait too long. Nerve damage can become permanent if ignored. Part 6. Real-life tip. Check your levels. If you're over 60, ask your doctor for a simple blood test to check your B12 levels. It's a quick test that can reveal a lot. And if caught early, the solution is often just a small supplement. Thousands of people have regained strength, balance, and confidence just by correcting this one deficiency. So don't let your legs suffer silently. Give your body the B12 it needs and feel the difference within weeks. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell. This is Healthy Horizon, bringing you smarter health, one step at a time. See you in the next video.